Her last attempt, in fact, just a week before she wrote her exam, she lives in Yellowknife. That was when the Yellowknife fires were happening. She had to evacuate her house, right? And even beyond the evacuation, boom, she scored more than 250. What am I talking about? Doctors, just follow the objectives. And we've made it very, very simple for you, okay? And what is the cost of not actually following a plan? Doctors, it will cost your time. So I told you today, I was talking to a friend, and then there's another doctor, I don't want to mention the country, and she's in Alberta, and she had told a friend that, look, I just want to go and try the exam, and if it doesn't go well, then I'll look for help about tutoring and how to go around it. I was like, look at how much the MCQ1 exam costs. Number two, from November this year, they are changing the structure. No more CDM. So if you want to even take the exam again, you need to wait till April next year. Why put yourself through that kind of, mental torture to sit for an exam, not knowing what the exam covers, just to go and try it? No, doctor, I don't think that is responsible. It will cost you your money if you don't follow a good plan. It will cost you a lot of emotional energy. I talk to so many doctors. A lot of people have become depressed because of this. And it can also lead to a delay in your career. So doctors, today I've brought you something which I believe can help solve a lot of our problems. So anyone who wants a study guide, you have the study guide for yourself. You know what? Don't let this thing happen to you. You can avoid the pothole that this gentleman is avoiding with a good study plan. You can avoid all the pitfalls and stay on the path to success. What should be your next steps? Your next step, number one, download the guide. Number two, print it out. Number three, review it. And number four, start your study journey right away. Start your study journey right away. Stick to the plan, doctors. Stick to the plan. Follow the objectives. Trust the process, and we are here to support you. And as you study, at times you need some motivation. So that is also there where Dr. Brony himself is speaking to you that stay dedicated, stay focused, and remember why you started. You're on the right path. And then when you go to page 3, now what we've done is that the medical council did not group them according to systems, but I know that many of us learn according to systems, okay? So that is why we have grouped it according to like emergency medicine, all those things. So according to emergency medicine, these are the topics you need to consider. Even in emergency medicine, there's a whole trauma part that you need to master, all right? Then respirology, just about 4 topics. So you see, if you are in a study group and you are spending, I don't know how many days on respirology, these are the topics you need to master in respirology. Neurology, these are the topics: ataxia, cerebrovascular accidents and transient ischemic attack and stroke, dizziness and vertigo, headaches, movement disorder, involuntary tic disorders, numbness, tingling, altered sensation, seizures and epilepsy. But remember that, and these are the objectives, but remember that under each objective are causal conditions. So you can have a headache, and that is under headache you may see conditions like migraine, tension, even intracranial space occupying lesions, all those ones. So don't just look at headache and go, but when you go to headache under the MC objective, then take your time and look at the causal conditions. So let me just take you through how it looks like. So if you go to psychiatry, you realize that there's a topic like anxiety. That is why just last week or this Sunday, we had to treat approach to anxiety, right? Then attention, learning, and school problems. Then mood disorders. Then obsessive compulsive and related disorders. Then personality disorders. Then psychosis. Then somatic symptoms and their related disorders. Then some. So if somebody should ask you, what are the high yield objectives in psychiatry? Just share a link with them and tell them that go to page 6. Everything is there. Then you go to, we also classify some topics as non-specific systems, because we don't like, it's not really under any unique system. So, for example, adults with developmental disabilities, allergic reactions and atopy, black health, calcium disorders,